Nearly 2,600 COVID deaths were reported across the country yesterday, the second highest total since the pandemic began. And with overall case rates and hospitalizations rising by the day, the White House Coronavirus Task Force is pushing public health officials harder than ever to act, reportedly going as far as to tell them to circumvent state and local policies if they don't deem them sufficient to stop the spread of COVID. In a weekly report sent out Sunday, which was obtained by CNN, the task force said, quote, if state and local policies do not reflect the seriousness of the current situation, all public health officials must alert the state population directly. It must be made clear that if you're over 65 or have significant health conditions, you should not enter any indoor public spaces where anyone is unmasked due to the immediate risk to your health. You should have groceries and medications delivered. And earlier today, CDC Director Robert Redfield issued a clear warning about the months ahead.
December and January and February are going to be rough times. I actually believe they're going to be the most difficult time in the public health history of this nation, largely because of the stress that it's going to put on our healthcare system.
The CDC also issued new guidelines today urging people to stay home over the holiday season ahead, but they're also relaxing quarantine protocols for people exposed to someone with COVID-19. CDC officials now say people without symptoms can stop quarantining after 7 days if they've had a negative test, or 10 days without a test at all. Before, they'd recommended a 14-day quarantine after exposure, which they still say is the safest option. But officials say they recognize that people are less likely to follow the stricter guidelines, and getting some people to quarantine early on is better than no quarantining. Still, these are just really recommendations. And as we've certainly learned, not everyone is willing to comply with them when it comes to quarantine, social distancing, and masks. In some cases, people can't comply for one reason or another. And as more and more health experts are arguing, shaming those people is likely doing a lot more harm than good. I'm joined now by Dr. Abraar Karan. He's an internist at Brigham and Women's Hospital and Harvard Medical School, whose piece, Stigma is Making the COVID-19 Pandemic More Invisible, recently appeared in the Boston Globe, and by Julia Marcus, an epidemiologist and associate professor at Harvard Medical School, who's written for The Atlantic about the dudes who won't wear masks and quarantine fatigue, among other issues. Doctors, thank you both for being here. Abraar, let me start with you. You wrote in your column about the story of two guys you know, Jim and Bob. I think they're pseudonyms, but we'll go with those. Tell us the story of Jim and Bob and the principle that you think they make manifest about how we should message when it comes to COVID.
Absolutely. Thanks so much, Adam, for having me. So this was a very sort of pragmatic occurrence that happened between some friends that I knew from back home. I'm originally from Los Angeles, and these were some friends who I'd gone to high school with. And I heard kind of through the grapevine through another friend that these two were sort of socializing outdoors with masks on, but Jim, and again, as you said, their pseudonyms, Jim and Bob. So essentially, what happened was Bob got a phone call from somebody from the golf course came up and said, your wife's on the phone. She has something to tell you. And Jim was sort of watching this happen. And when Bob got off the phone, he said, oh, it was nothing. And Jim was like, that seemed kind of like an emergency. What was it? And he said, oh, no, we just kind of been exposed to somebody that that had COVID like last weekend, but, it's not a big deal. And, Jim had a pregnant wife at home. So that was a concern for him. And so as they were sort of discussing, Jim was quite upset and said, Bob, I can't believe you'd be irresponsible like this and come play golf. You should be quarantining. You should be getting a test done. And so then later when Bob did get that test done, he found out that he was positive. And he then revealed to Jim that, actually that day it was not just that he'd been exposed. It was that he'd found out his partner had also tested positive, but he didn't feel comfortable sharing that information because he was very embarrassed by what had happened. And I think that, even again, since I wrote that op-ed, I've had other friends who've reached out to me who've been infected all over the country in different places. And we kind of talk about what's important in terms of contact tracing and helping to tell other people that have been exposed. But a lot of those people express that they're very nervous about the judgment that they'll receive. And so instead they kind of asked others that they'd been around, oh, are you having any symptoms? Are you feeling okay? Just to kind of check. But weren't forthright to say, hey, I'm actually positive. I got infected. And I was thinking to myself, because, as a clinician, if I were to get infected and then infect other people unknowingly, I think people would have a little bit more sympathy to say, oh, well, he got infected at work taking care of COVID patients, and so that's okay. Whereas if you say, oh, well, Bob got infected because he was socializing, and I don't deem that a worthy reason to get infected, then the judgment and shame and stigma sort of starts building. And I'll tell you this, I've taken care of a lot of patients who had COVID. I've taken care of a lot of patients who've come in with other effects from the pandemic, including depression, suicide attempts, reversion to alcoholism, reversion to substance abuse. These are real illnesses that people have been fighting with, struggling with, that have been made worse. And so when we think about socializing as one example of something we don't deem worthy, socializing is actually very important for health. And so it gets complicated.
Julia Marcus, you wrote a piece that I remember reading in The Atlantic, I think this was back in May, in which you touched on a number of the themes that Abraar just spoke about and made a comparison between the COVID crisis right now and either the early days or the worst days of the AIDS and HIV and AIDS crisis back in the 80s, and the way that people were told to behave and the effect that the judgments that were passed on people who were deemed not to be behaving safely might have had. Can you elaborate on that comparison a little bit?
Yeah, absolutely. I've been thinking about this whole pandemic unfolding through the eyes of an HIV prevention researcher. And what we know from HIV and really from any infectious disease outbreak is that stigma ends up being a real barrier to public health efforts. And stigma plays out in the ways that Dr. Karan was just describing, where people become fearful of disclosure and fearful of telling people that they attended an event, that they may have been exposed, that they have symptoms, and not just fearful of telling each other and friends and family, but fearful of complying with contact tracers. And so we end up with a situation where people are afraid to engage in public health efforts. And actually what we really need to be doing right now is building trust in the community and ensuring that people are willing to remain engaged. And the way that stigma happens can often be through shame-inducing messages and moralizing about behavior. And we've seen plenty of that in this pandemic around an emphasis on personal responsibility and even, elected officials saying, stop with the bad behavior. This is your fault. We'd all be able to have a nice Thanksgiving if you had all behaved. And when we call people selfish and reckless for what we perceive to be risky behavior, the result is that when people become infected, they feel like they're bad people and they don't want to disclose. And so it's a direct response to that moralizing. So I want to be clear here that the alternative is not to say, go ahead, have your indoor party, have a great time. This isn't about condoning or even coddling risky behavior. It's really about approaching people with compassion and doing what will work best to help people reduce their risk. And that is not going to be shaming. It's actually going to be meeting people where they are and rather than judging them, saying, okay, we understand this is hard and here are ways that you can reduce your risk in this situation.
I'm curious about whether the two of you have, what you're saying makes a lot of sense. Have you ever found your own conviction that less shaming, stigmatizing messaging is the way to go, that people should be, engaged with in an empathetic manner rather than try to... In the course of the past few months, have you found your own tolerance tested when it comes to things you'll see on the TV or things that you hear from family and friends? Or have you been able to sort of fully live the method that you're encouraging us to think about adopting here? I ask that, by the way, that, awkward question. I ask it in part because, Julia, I think I've never met you in person, but I've interacted with you on Twitter a couple times, spoken to you here, I believe. And the first interaction we had was when I made some reference to people behaving stupidly. And you tweeted back at me in a very gentle way, something like, talking about people behaving stupidly is maybe not the best messaging. And I took your point. But do you feel tempted to pass judgment on people periodically when you see them doing certain things that they probably shouldn't be doing or not?
Yeah, it's a great question. And I think what that really highlights is that the frustration and anger that people are feeling is totally understandable. This is a scary situation. And if I'm in a place where I cannot move away from somebody and I'm indoors and close to them and they're not wearing a mask or their mask is falling off, it will be frustrating for me. And I think in that situation, it is well within people's rights to say, excuse me, can you give me some space or would you mind pulling up your mask? But I think what's important here is thinking about from a kind of authoritative perspective when we think about the messaging that we're putting out there as health professionals and as elected officials. When we message in a way that's shame-inducing, there will be repercussions. And it may be counterproductive to our shared goal of reducing transmission as much as
Abraar, go ahead. Yeah, please.
Even recently, I've had friends who have returned from Thanksgiving who have, told me that they're going to be going out to bars in Boston. And even in an attempt to be not stigmatizing and not judgmental and say, oh, well, just FYI, like, it's been about 4 or 5 days since you got back, and the incubation period, the median is around 5 days. So it may not be a good idea to do this. Even then, I've gotten responses from people saying, oh, I don't appreciate you lecturing me or being judgmental. And I've had to step back and apologize and say, I'm sorry, I really don't mean that in a judgmental way. And what you choose to do, I just hope you do it safely. And I care about you. I'm concerned. As a doctor, obviously, I'm seeing this and I don't want it to happen to you. But I understand that, it's hard to quarantine. It's hard to do everything perfectly. It's hard to do any public health intervention perfectly. And as doctors, we're used to that. We work with our patients. We don't stigmatize them when they're struggling with disease, just as we shouldn't be stigmatizing people that are struggling with the pandemic in different ways. Everyone's struggling in different ways.
I'm glad you mentioned that, because one thing that I've been pondering as I've tried to engage the point that both of you are making here is I wonder if the line between forceful but appropriate messaging on the one hand and shaming, stigmatizing, or even incendiary messaging, I assume that to a large extent it's in the eye of the beholder, right? That something, I might think that it was completely appropriate for Governor Baker, for example, to talk about a certain behavior a certain way, but the people who might be inclined to engage in that behavior might have a very different take. Does that make sense?
I think it does, and I think something you're kind of getting at is also that we do need to be sharing messages about risk, and it's not. The answer here is not to stop saying anything to the public, right? And in the example that Dr. Karan gave, I don't know what his text message said exactly, and maybe we could think about the wording, but I don't think there's anything wrong with saying there is some risk here. I think is about avoiding things like you should do this, and if you don't do this, you're a bad person. But remaining clear that here's the safest option. Risk is very high right now. But if you are going to do this, here are ways to try to mitigate risk as much as possible. And that becomes more informative and also less stigmatizing, because we're giving people a sense of how they can reduce their risk, even if they do choose to do something that we may not recommend that they do right now.
Abraar, as a clinician, has your approach to this changed over the course of the pandemic? Do you look back on conversations that you had early on and think, oh, I was doing it all wrong?
Well, I do think that over time I've started to notice the parallels between the way that we as doctors learn to communicate and the way that we really our practice of medicine is based in empathy. And I think that as time went on with the epidemic, there were many times where it felt the easy route was to sort of blame people or judge them or say you're not being responsible or you're overburdening the healthcare system. And, yes, a lot of those things are true in the sense that the healthcare system is being overburdened, but that's for a lot of reasons. And I think that to blame individuals and shame them and whatnot is not, at least for me, is not the way through this, and is not the way that we're going to get communities on board. It's not the way we're going to build trust. And that is key right now, right? And any intervention that we have, whether it be vaccines, whether it be masks, whether it be testing, whether it be disclosure, whether it be tracing, it's all based in people trusting the system, working with leaders, working with communities. That, in my opinion, is how the epidemic will be stopped.
Julia, do you have any other counsel that you would give to elected officials, those of us in the media, just people who might be inclined to pass judgment on family or friends who we think are doing it wrong? I'm using that phrase in quotes. In particular, from the conversations that you had for the Atlantic piece on men, I think it was mostly men, if not all men, who just won't wear masks. What insights did you glean from talking with that group?
Yeah, so I wrote a piece that focused on not just men, but there's a pattern of it being more men and more conservative men who don't want to wear masks. And after writing that piece, I got contacted by a lot of such men. And I think one of the reasons they hadn't heard a health professional talking about them in a way that was compassionate. They'd really just been dismissed, yelled at, shamed. And I really tried to, in that piece, humanize them and really think about what was going on for them and what their position was, what their barriers were, and how potentially we could overcome those by actually, addressing them head on rather than dismissing them or condemning them. And in those conversations I had, we actually, I think, made some progress. I really tried to just hear what was going on for them. Concerns around infringement on personal freedom, concerns around, feeling less masculine, all of these things that I think have been so easy for a lot of people to dismiss, just acknowledging them and hearing them and having that conversation and really focusing on mask wearing where it matters most, instead of these sort of absolutist messages around you must wear a mask at all times when you're outdoors. And when you're out of your house, I think really saying, look, where it really matters is in public indoor spaces when people can't move away from you and they can't from you. And in the end, I think there was real progress in those conversations, and some of those meant that they did change their minds. And so, of course, we can't have these one-on-one conversations with everyone, but I think it is a testament to what happens when you start from a place of compassion, even when you don't agree with someone, and even when you think their position is ridiculous. That shaming them actually is not going to be productive in terms of our shared goal here, and actually just trying to meet them where they are ends up being much more productive.
Let's leave it on that upbeat note. Julia Marcus, Abraar Karan, thank you both for talking this through.
Thank you.
Thank you.